Welcome back to the Deep Dive. Today we're taking a look at some fascinating materials from Blood Test UK. Our focus is something really important: how blood tests can actually find diabetes. And more than that, why finding it early is such a huge advantage, especially for those of us here in the UK.
That's right. Our mission today is to really break down what you need to know, and quickly, we're going to look at the specific tests the NHS uses and really highlight the benefits of seeing your health numbers as more than just data. They're early warnings.
Okay, let's get into it then. The sources show that for diabetes, doctors are looking at two key things you can get checked at your local GP surgery. Those are glucose and something called HbA1c.
Yeah, and the HbA1c test is, well, it's pretty clever, if you want a simple way to think about it. The HbA1c is basically a report card for your blood sugar, but it's not for just one day. It shows the average sugar level over the last 2 or even 3 months.
So it looks past like a single big meal or a stressful day.
Exactly. It gives the long-term picture, which is why the NICE guidelines here in the UK really emphasize it for people over 40. It's the ultimate measure of consistency.
Okay, so that's the reliable history. And the other test is the fasting blood glucose test. The material from Blood Test UK really stresses how important the prep for this one is. You have to fast for at least 8 hours, so no food, just water.
And that strict preparation is what makes the reading so accurate. If your body is processing sugar correctly, your levels should be pretty low after that long without food. So when that number climbs above 7 mmol, that's the signal that some kind of intervention is needed. Context is everything.
Right, so because the HbA1c gives us that 3-month window, does that early knowledge really help stop the really serious long-term problems for UK patients?
Oh, absolutely. Timely diagnosis is key to stopping that domino effect of severe complications. The biggest things the NHS is trying to get ahead of are serious cardiovascular disease, so heart problems and nerve damage.
And getting ahead of the curve means you can start interventions immediately.
Right. And that dramatically improves health outcomes down the line.
Okay, wait. Here's something I found really interesting in the materials. The blood tests, they don't just stop at sugar. They also mention checking for markers like creatinine and urea. Why are we suddenly looking at kidney health if the initial check is for diabetes?
That's a massive sort of silent benefit of this kind of routine screening. You see, chronic high blood sugar puts a lot of stress on the kidneys over time. The kidneys are your body's filters, right? And creatinine and urea are waste products. If those levels are high, it's an early warning that the filters are starting to struggle. So by checking this at the same time, the NHS basically bakes a preventative kidney screen right into the diabetes test.
That proactive approach seems to carry right through into management too. After a diagnosis, the material from Blood Test UK says the NHS focuses a lot on holistic strategies.
It does. The focus isn't just medical, it's very proactive. They really back specific, achievable lifestyle changes. We're talking about simple things like eating more fruits and vegetables or getting regular physical activity.
Like just daily walking or cycling.
Exactly. Things that are proven to massively improve health outcomes, and consistent blood monitoring helps people stick to those plans.
So it all comes together. Quick testing through the NHS is really the gateway to getting great care and making those important lifestyle changes fast.
It is. Now, we've seen that the glucose and HbA1c tests are foundational for diagnosing type 2 diabetes. But the material from Blood Test UK did note something else. It said testing for type 1 is different. For type 1, specialists often look for specific antibodies in the blood. So here's a thought for you to ponder. What is that difference in testing, looking for antibodies, an immune response, versus looking at sugar averages? Tell us about the fundamental difference in the cause of these two conditions.